for every 1 unit increase in sulfur dioxide exposure, you're about 3.4 times more likely to have a low birth weight baby. Now, a unit increase is a large increase in sulfur dioxide exposure. So if we just looked at a small incremental change, values that we actually had in our database, that still translated to a 30% higher increase in low birth weight. For preterm birth, the odds were 2 times more likely to have a premature baby for every 1 unit increase in sulfur dioxide exposure, even after adjusting for factors like socioeconomic status, medical history, behavioral risk factors, demographic factors.
A groundbreaking study published in the journal Science of the Total Environment unveils the harrowing health impact of extreme climate change on children. Led by Dr. Weeda of the University of Western Australia and Professor Corey Bradshaw of Flinders University, the research amalgamates 163 health studies worldwide, shedding light on the grave consequences awaiting future generations. The findings paint a grim picture. Exposure to extreme temperature is projected to increase the risk of preterm birth by a staggering 60%. This alarming statistic underscores the urgent need for global action to mitigate impending health crisis. Professor Corey Bradshaw said, "We have crunched the data to show how certain types of future weather events will worsen particular medical issues in the population. Respiratory diseases, morbidity, mortality, and other adverse health outcomes are also expected to surge in tandem with escalating climate extremes." Moreover, the study highlights the disproportionate burden borne by children in low-income countries, where access to healthcare infrastructure and food security is precarious. However, even affluent nations are not immune to the looming threat, as evidenced by the mounting health risks detailed in the research. The nexus between climate change and childhood ailment is unmistakable. Cold extremes exacerbate respiratory diseases, while drought and heavy rainfall stunts and worsen overall health outcomes. The implications are dire, with significant social, financial, and healthcare ramifications looming on the horizon. The economic toll of climate-induced health crisis is staggering. Asthma alone is projected to cost billions of dollars, with burden disproportionately falling on families and healthcare systems. The urgency of addressing climate change cannot be overstated, as failure to act swiftly will consign future generations to a lifetime of avoidable suffering and hardship. In light of these findings, concerted global efforts are imperative to curb greenhouse gas emissions, bolster healthcare infrastructure, and safeguard the well-being of our most vulnerable population. The time to act is now, lest we condemn our children to a future marred by preventable health crisis wrought by unchecked climate change.